So, Trish, it's really good to catch up with you today. As a GP, I'm constantly talking to patients who are not only facing up to having cancer and treatment, but they're asking me about the COVID vaccination. And a lot of them are really concerned about whether they should be having it. And they haven't necessarily been able to have that discussion with their oncology nurse or their oncologist. So I just wondered what your feelings were on that.
So the take-home message is that the vaccine is very safe for people on both chemotherapy and radiotherapy treatments. We are encouraging everybody to have the vaccine and to have it ideally as soon as they are offered it. For the vast majority of people on treatment, there is no issue about the timing of the vaccination, because that's another question I get asked all of the time, and I suspect you do too. There are a couple of caveats. The first is that if people are about to start treatment, then ideally they should have their vaccination before they start, when their immune system is strong, so they get the best possible response. That's not always possible. The other thing that is ideal if people are on chemotherapy treatment, because that lowers their white cells. Again, the timing is ideally just before their next dose of chemotherapy, when their blood count is best. But vaccination at any time is better than no vaccine. So the take-home message is, please have your vaccine. It's very safe. It's not a live vaccine. There are very few people who can't safely have it. And that, as you know better than me, Louise, is people who have had reactions to the previous components of the vaccine. How do you guys decide in your vaccination clinics who can't safely be vaccinated?
So we actually are deciding on the priority groups according to what we've been advised centrally. So we're getting very little say on that, but I think it's absolutely right that we're prioritising obviously the elderly first and foremost, and then the people who have other things that mean that they are frail and vulnerable. And of course, cancer patients having chemotherapy, as you say, their immune system may well be knocked, and we do need to make sure that they're covered with the vaccine. So cancer patients who are having treatment, we put them into the priority 4 group, and we're well onto them because we're doing so well calling our patients forward, and they are attending. As I say, I think as a group, the cancer patients have perhaps proved the most difficult, because they're trying to deal with the fact that they have cancer, that they're undergoing treatment that might be making them feel poorly, and then they worry that on top of that, the vaccination will make them feel poorly. But as you say, the contraindications in a cancer patient are the same as the rest of the population, and we're not actually seeing significant side effects from this vaccine. People are getting a sore arm. They may feel a little sort of headachy and fluey for 12 hours, which we advise them to take a bit of paracetamol. But it's no different from the many other vaccines that we use. And the best example would be the annual flu jab.
So one of the queries I get when I'm doing my clinics, Louise, is people who clearly fall into the priority categories because they are a bit older and they're on treatment, but they haven't heard yet. What we've been saying to them so far is, please don't ring your GP surgery, because we know you're getting lots of phone calls from people about their vaccine. But I understand that there's now an alternative way for them to book themselves in if they've not heard.
So I would hope that the priority groups are getting contacted by their surgeries to come forward and have their vaccine. And the onus isn't on them to ring their surgery. But if people feel that they have been overlooked, then they should contact us. But increasingly, the big centres are now saying, feel free to ring us. If you're over 70 and you're vulnerable, ring us. It is still difficult for these younger cancer patients. And of course, increasingly, we've got cancer patients who are very, very young. And what I have been saying to my GP colleagues is, go looking for these cancer patients and find them and give them a ring and get them onto your vaccination clinics. So, although it is supposed to be a don't ring your surgery policy, I think we've got to be a bit more relaxed about that. If someone's worried out there, then that's what we're here for in dental practice, to answer whatever their worries about their health are, and actually what more reason could you need than a worry about whether you should have the COVID vaccine or not? So yeah, they should give us a ring.
The other thing, of course, is a lot of our patients who are on active treatment are shielding.
That were shielding before, Trish, they have got a shielding code on them. But you and I have spoken before about these people who recently have a new diagnosis or recently become unwell. Again, I would hope that the practices have had the forethought to find these patients. But I think if a patient feels that it is a new thing and the practice may not be aware of that, then they should contact their practice. And I know that at Weston Park, Trish, you've been encouraging the consultants and the specialist nurses to also give us a little bit of a kick in the letter to say, you know, this patient really does need to get on and have their vaccine. And we're very grateful for that reminder.
And talking of reminders, I think the other thing that we need to just make sure we're doing is remind people that even when they're vaccinated, they still need to be very careful and to continue to follow the guidance about protecting themselves, because although the vaccine reduces the risk of being severely ill with COVID, it doesn't make them completely unable to catch it, and it also means if they get a mild infection, they can also spread it despite being vaccinated.
I think that's such a good point, isn't it? Because we are talking about vulnerable, frail people, people who really do need to be careful, because if they did get the virus, they would potentially be very poorly. The vaccine, really from really early on in the trials, we were convinced that it would protect from significant disease, but it certainly doesn't protect fully from catching some kind of mild form of it. And for cancer patients having treatment, even if they got a mild dose of it, they could feel really quite poorly, and it could interrupt their treatment for their cancer, for example. So it's very, very important that everybody, not just our cancer patients, understand that this doesn't change any of the rules that we're being told. You know, we do need to continue to socially distance. We do need to be careful with hand hygiene. We do need to continue using our masks unless there's a contraindication for that. So, Trish, thanks for your time. It's been great to catch up. I think in summary, we're both in agreement that COVID vaccination for our cancer patients is really important. And so, you know, it's up to myself and my colleagues in primary care to make sure that we get on and get these patients safely vaccinated. So thanks very much.
Been a pleasure.